All right, welcome to 650 Medical Model Practice. I am so excited to incorporate the work of acute care into your academic career. I have spent a lot of time in the hospital with people on their worst days, and I'm excited to share with you the potential that you hold by being able to give someone that hope. Countless number of patients would lie in their bed, hear me knock on their door, look to the door, see me walk in, and think, oh God, here comes another person. Another test, another screen, more bad news. And it was such a gift to be with them in those moments. Whether it was the ICU, when they were intubated and all we could do is communicate with their eyes, or they had just been told by the physician that they will not walk again. And I'm the first person to walk in the room, showing them what they will never be able to do again, but giving them a plan to show them how they will live again. A theme that always stuck with me in acute care was that it was not my priority to make sure that people stayed alive. That was not my job. In the acute care world, you have to know your role. My job is to help people live. And that'll be a theme throughout this course. So what I intend to do is to walk you through the acute care process. How do you work with someone who is still intubated and just coming off sedation? How do you provide the same level of care for someone who just had their hip or their knee replaced? Collectively, it's going to be a lot. This will be a heavy course, and the requirements outside of the class are going to be high. I had a lot of fear when getting prepared for this course that I was not going to be able to provide you with all the information you needed to be successful. Because I was thinking of what I didn't have when I stepped onto the floor. My promise for you is that I will give you the confidence to know what is needed to step onto the floor, to treat, to evaluate, to discharge plan, to know how to keep people safe, and how to get them from a place of absolute despair to hope. The path we will take for that will be split into two ways. I'll provide my lectures like this, and then the labs are where we're going to do a lot of the hands-on work. So similar to my previous, similar to leadership management, you all will have my cell phone here. So if you have any troubles, difficulties, please feel free to reach out to me. Similar to leadership management, you all will have my cell phone here. So if you have any troubles, difficulties, please feel free to reach out to me. But I am going to give you these lectures ready to be viewed by Monday morning. So my plan is to record on these Fridays. Have all my lectures done Friday. So if you want to watch over the weekend, you're more than able to. But that way Monday you can watch it, and I can't stress it enough. You got to watch the lectures. You have to read the material. You have to watch the videos. Because when it comes to lab time, we're moving. I want you all to have the hands-on experience of practicing these difficult transfers, difficult manipulations, working through in your mind the case examples that you will be faced with in acute care. Labs will run either on Wednesdays from 9 to 12 or Thursdays from 9 to 12. Here we have the course outcomes, the standards that we will be looking at, and what I want to stress is throughout this course, I hope that you gain an understanding of how to prioritize what is necessary. My first week on the cardiac floor at Bergen Mercy, I came from inpatient rehab to cardiac, or to acute care. And my first thought was, well, let's get this person dressed. Let's put their clothes on. Because that is what I thought was the priority. The nurse was furious. What are you doing? I can't access his monitors if he's wearing that shirt. He has to wear his gown. You don't know what you don't know. So being able to prioritize what are our needs. So from the ICU level, it is life, living, stability. Are they in a state where we can push the body to get them up? Each floor in an acute care hospital has its own specific priorities. Throughout the semester, we will go over each priority. The textbook that you're going to need is the Smith, Gebai, and Holm, the 3rd edition. It's different from last year's book, so I'm making some changes to our lectures. But a lot of what we did, what Professor Uyghur used last year, I'm going to use her wonderful foundation to help guide you through the semester. This will be a 4-credit-hour course, so we will meet. So I'll have 1 hour of lecture ready for you, lecture content ready for you each week, and then we'll have the 3 face-to-face lab hours a week. So that's total 9 hours a week is what is going to be expected of this course. In terms of the assignments that you'll have to do, so really there are 2 exams. There's a midterm, there's a final. There's an assessment practical, there's an intervention plan, simulation check, and then lab values, vital signs, competencies. The big things that you're going to have to look at, so the exams are going to be huge, and then your practicals. So we'll have the high fidelity simulation, and then we're going into the hospital at the end of the semester, where you will be graded on how you perform in the hospital. I will be with you, Professor Uyghur will be with you, and we will work together so that you can feel comfortable and confident moving into that position. Again, that's in December. And if you have any doubt, how am I going to get there? 1 week at a time. 1 week at a time, 1 assignment at a time. We'll get through this whole giant textbook. Similar to what we talked about in leadership and management, let's do a quick discussion about AI. I want you to, again, use every tool at your disposal. But using AI to just give you answers won't serve you well. The important thing that I want you to take a look at is how can you use AI as a tutor? How can you use AI to bounce back ideas so that you understand what is necessary? When I'm preparing for a lecture, what I'll do is I'll give the lecture to AI. And I'll say, what was I missing? What was not clear for my students? And then it will come back with a list of my pitfalls, and then I will go back to the text and I will retain that information so that I can make something even better and greater for you. That's what I hope for you. When it comes down to the actual providing care, assessments, evaluation, interventions, discharges, AI can't help you in that patient to practitioner experience. So use it, but be intentional with how you use it. Throughout the syllabus here, we'll work through where we're going. This first week, we're going to really focus on the foundations of OT in acute care, how to use evidence-based practice, documentation and billing introduction, just very broad. Week 2, we'll move into the understanding the acute care environment and the system, lab values, diagnostic tests, and then week 3 and on, we start hitting the body. So body systems, understanding what interventions we can implement, understanding what assessments we can use, understanding what role do we play in building this recovery plan from the earliest stages. Questions, concerns, uncertainties, please feel free to reach out, but also be sure to check the syllabus first. I believe that's it in terms of the syllabus. I really want to stress, I had my doubts. I did. And the first time I got someone up on a vent with the PT, with the respiratory therapist, being a part of that team, oh, I saw it. We start the next state. We begin the next phase. So as we look at this medical model and try to identify, all right, what do we need to do in these moments to help our patients move from critical to potential? That's what we're going to explore this semester. So I'm excited. It's going to be a challenge. It's going to be tough. But I'm so excited to support each and every one of you as we work to figure this out. Thank you. And I'll see you with the next video, I guess. I'm still trying to figure out this video thing. So I'll see you at the next video, and then I will see you in lab on Wednesday or on Thursday. Thank you.